action.
All right. Hi, this is Jessica Randall. I'm completing my PICC line dressing change. So my first thing is I'm going to go check the orders, check the facility's protocol on dressing change, and gather all my equipment. So I did that, got my dressing change equipment, my sterile field. This is my patient, Miss Kennard, and I'm going to go in. I'm going to put on my PPEs, put on my gloves, but also first I want to identify the patient. I've checked her armband. This is Miss Kennard. I'm going to explain to Miss Kennard what I'm going to do. Miss Kennard, I'm going to change your PICC line dressing as I told you earlier. Two things. Either you're going to have to turn your head away from the dressing so we won't break any sterile field here, and put on a mask. So per protocol of this facility, you can do both. So we're going to have you put your mask on. So patient put a mask on. And also if you can please keep your head turned to the left while I'm doing your dressing change, that would be great. I appreciate it. So as a disclaimer, I am allergic to the mask. I would try to keep it on as long as I can. So I'm going to put my mask on, which I can't, not right now. And do hand hygiene. And talk to the patient a little bit, see how she's going, asking her if she's in any pain or any discomfort at this time, because if she was, then I would just give her something for pain. I would close the curtains, even though she's in a private room. I would take and move her bedside table a little closer so my sterile field will be in proximity to the patient. Again, move the bed up to my height and to make sure the proximity of everything is good. If she had fluids running, I would put everything on hold and before I did the dressing change. But she doesn't have it running. All right, so I'm going to go in. I'm going to tell her that we get ready to start her dressing change. She's okay. Everything is good. So before I do that, I'm going to palpate to see if there's any tenderness, see if she's having any pain or any discomfort at this time. Everything looks good. So I'm going to anchor it a little bit to make sure that I don't pull it out, and just gently pull the taping apart. And then I'm going to pull it perpendicular up and away. I'm going to discard, my trash can is right here. I'm going to discard the dressing. Oh God. And my gloves. And the trash can. I'm going to hand hygiene again. Making sure that the patient is okay. All right. Just to look, everything looks good. I'm going to open my sterile field. And you're supposed to wear 2 masks, but because I'm allergic, I can't do it. Matter of fact, this is itching now. So I'm just going to take this one out. But normally you're supposed to wear 2 masks when you're doing a dressing change. So I'm going to just leave that there. Get my sterile gloves out. Alrighty, my sterile field is ready. I'm just going to make sure everything is good again and make sure I palpate. I see no dry blood, no discharge or anything around there, but we're still going to clean with some alcohol. So I'm just going to go from the inside near the insertion site out to clean it. But before I did this, I did ask the patient, as a disclaimer, if she was allergic to any tape or cleaning supplies like the alcohol or the chlorhexidine. So I did ask her that. I'm sorry, I didn't mention it earlier. So again, I'm going to use the alcohol antimicrobial disinfectant from the inside out to clean. And I'm going to toss it in the trash. Let that dry. Then I'm going to use the chlorhexidine. We're going to go back and forth in a back and forth motion vigorously for 30 seconds. Cleaning. And discard it. You're going to let that dry. Make sure the patient is doing okay. She is. Then I'm going to put the dressing on it. Check the sutures and make sure everything was okay. The sutures are fine. And if she had a stabilizer, I will follow the manufacturer's guidance with that as far as cleaning it, or if it needed to be discarded, follow their protocol to do that. But she does not have one on. Excuse me. So we're going to put the dressing on gently, still making sure that I can see the insertion site. Before I put the Tegaderm on, we're going to put on the skin protectant just to make sure nothing's happening. She doesn't, you know, have any reactions or anything to the Tegaderm. So we're going to discard that. Next, we're going to put on the Tegaderm, making sure that we can see the insertion site through the Tegaderm. I'm going to gently put that on and secure that to the patient's arm. And then we're going to pull that off. Also, at this time, we're going to make sure we're going to measure the length of the lumen outside. So I think it's supposed to be 3 dots. So we're going to do that, measure the length of the lumen. She does have just a single lumen at this time. So we're going to clean that also. We're going to pull the tape off on that and discard it. Make sure that I take off the end cap. I'm going to close the lumen, make sure it's closed. Take off the end cap, discard that, clean it vigorously with some antimicrobial. And this institution's policy is flush is with normal saline, 1 ml. So I would do that over a minute, or you can do it 10 slow pushes, either or. So after I clean it, make sure that I unclamp the lumen and do my flush. After a minute, I'm finished with my flush. I'm going to clean it again with the antimicrobial, excuse me, antimicrobial wipe, put on a clean, new, sterile end cap, clamp the lumen after I'm done, and make sure that the patient is okay. Patient says yes. I'm going to, at this time, discard all of my equipment in the trash. Nasty trash. Hand hygiene. And if the patient was getting a flush, if the patient was getting a IV running fluids at this time, I would make sure that I hooked them back up. Make sure everything was correct on the pump before I did that. Also, I would also date, time, and my initials on the dressing before I leave. I would ask the patient again if they were okay. I would lower the bed, put the call bell within their reach, and make sure all my mess was cleaned up. And then I would go and document in the chart that it was completed, the date, time, how the patient responded to it. Make sure I took their mask off as well before I left the room. Make sure once in my documentation, make sure that the patient, I stated, how the patient reacted and if everything was okay. Thank you.